Psoriasis is an extremely common skin condition. It affects around 2% of the population in the major Western society. It causes an awful lot of distress to patients because it presents with elevated red, itchy, scaly plaques that can be sited typically on what we call the extensor sites, so that's the knees, the elbows and the scalp.
It was originally thought to be a disease of excess cell turnover, but then over the last 30-40 years we've recognized it's caused by inflammation, and what we call T cells is driven by white cells that flood in from the bloodstream into the skin and cause the skin to become more inflamed.
Studies show that both the physical and mental burden of psoriasis ranks very highly among many other diseases where nobody would hesitate a second to say these are really significant conditions. Even cancer, significant heart disease, diabetes, they all, when it comes to the burden for the patient, rank lower than psoriasis. So it's one of the diseases that probably affect patients' life the most.
The impact of psoriasis on patients is profound. Both from a physical perspective and from a psychosocial perspective. And for instance, I'm wearing a dark jacket. I would never wear a dark jacket if I had psoriasis because I've been doing this all day long. So it has a major influence on your peer-to-peer, not just your family, but also your work-related activities.
And if you develop a skin condition that's highly visible, very distressing, at a critical point of your life, you may gain control of that disease 10 years down the line, but if you've lived with it, it will have an ongoing impact for the rest of your life. So there's this concept of cumulative life course impairment of struggling with a disease like psoriasis.
Recognize, like diabetics have to take their insulin every day, that you will have to treat yourself. There are times that your disease will get better and you can lay off treatment, but in order to maintain a normal lifestyle and be comfortable, you have to treat accordingly.